Due to the graphic nature of this program, viewer discretion is advised.
Get him on IV fluid.
Milwaukee Emergency Center for Animals Television is brought to you by Animal Fairy Charities, a premier organization focusing on animal welfare while teaching compassion to young children through education, experience, and leadership. For Pet's Sake Dog Training, Bichon and Little Buddies Rescue, and Camp Bow Wow, premier doggy day and overnight camps.
This is Pepper. Pepper is a 2011 model, so that would be like 5 years old guinea pig that is a female intact, so she hasn't been spayed. But she came in because she was seizuring, and she was actually having multiple seizures, one after the other. And if they don't have vitamin C, this is a big requirement for them, vitamin C. And also if they get mites, which is little bugs or lice, they get in their skin and they want to itch so badly that they actually have seizures. And you can tell how itchy he still is. See how when I scratch the back, how he's kind of biting. No one knows what the mechanism is and why they do that, because other animals like rabbits and rats and all other types of exotic pets also will get lice, like people get lice too, but you don't scratch so much that you seizure. For some reason, it's unique to the guinea pig that they can have multiple seizures, and sometimes you even have to treat the seizures. But this guy came in for seizures. We're treating with ivermectin, which is a type of drug that helps treat the mice. And then she was so bad that she was scratching herself so much that she wasn't eating, and she actually got bloated. She'll be treated probably like once every 10 days. She'll get an injection, or we'll put her on another type of medication that treats the lice. But this is going to be about a month to 6 weeks process to get rid of these lice. So this dog was brought in because of suddenly licking and biting and scratching all over her whole body, particularly around the neck. What this is an allergy spot, or it's called a hot spot. We call it a hot spot because there's an area of redness around the neck. Right underneath here. So it's all red and raw, and it becomes all moist. And it's an allergy due to many different things. Pollens, yeast, moles, just like people get. Dogs get hot spots too, and it causes them just to go crazy. Even around the ears, there's a little bit of redness. You can see all here, right in here, and she's been gnawing at that. This dog has more of a chronic allergy, so the vet is actually testing for what the dog is allergic to. But this, being a acute onset, means the dog's going crazy and just tearing at itself. What we treat with is we give a shot of steroids and we give a shot of Benadryl to help stop this immediately, and then we'll clip up the area and clean it up.
This will feel nice. Oh, yeah. That feels good. Right?
Looks pretty good.
Hi, buddy. Hi, baby. Hi, baby. How are you? I missed you. Yes, I missed you. Good
We just have a
girl.
couple things to go over here.
We moved here several weeks ago from Arizona, and obviously there are environmental things that are different between Wisconsin and Arizona. Arizona being a desert and it being so lush and green and beautiful here. And shortly after we moved here, she started itching a lot. And it would be occasional, but then last night, after she had a romp in the grass, she was itching uncontrollably. And I couldn't get her comfortable. I did the Benadryl thing, and it was so bad at 5 o'clock this morning, I was beside myself. So I brought her in and found out that she has a hot spot. I thought Arizona was a hot spot, but apparently there's a different kind of hot spot. The treatment here is outstanding. They are just so friendly, and they calm me down when I worry that it's something real serious. I was afraid to leave her here even because she is a service animal. We are together 24/7. And but knowing what great care they give, I was comfortable and reassured that she was going to be okay, like the doctor said she would.
Milwaukee Emergency Center for Animals Television is brought to you by Animal Fairy Charities, a premier organization focusing on animal welfare while teaching compassion to young children. For Pet's Sake Dog Training, Bichon and Little Buddies Rescue, and Camp Bow Wow, premier doggy day and overnight camps. And now, a word from our sponsors.
For over a decade, Fetch magazine has examined the unique bond humans have with their canine companions by publishing popular dog-related topics. With a strong commitment to dogs in need, Fetch also prints local adoptables in each issue, supplies affordable advertising to businesses, and gives rescues 30% off of ads. This year, Fetch is offering $15 subscriptions for your convenience. For more information, visit www.fetchmag.com or pick up your free copy at a local pet establishment near you. Go Fetch!
Boarding, grooming, training, and more. When it comes to your pet, Animal Motel is their home away from home. At Animal Motel, we offer a top-of-the-line facility with boarding suites for both dogs and cats, outdoor play yards, a training hall, and so much more. Whether they're here for obedience training, grooming, or an extended stay, we promise your dog and cat will be part of our family. Animal Motel. Personalized care for your precious pets.
Looking to get some training for your dog? For Pet's Sake is your one-stop dog training center. We offer all-inclusive obedience training, canine sports training, specialty classes, and more. We provide training classes in 3 convenient locations with our main facility in Mugwanago, which boasts a fully matted 5,200 square foot training hall. While in Mugwanago, check out our Bichon Buddy Rescue and take home your new pet. Bichon and Little Buddies Rescue takes in Bichons, other small dog breeds, and cats that need to be rehomed for various reasons.
So this is Jake. He is a ball python who presented to the clinic with some wounds on his back. And you can see right here that he's got wounds by the tail and all up and down the back, and even by his muzzle. He was being fed with a live rodent, a rat or a mouse. And this is a common problem that we have with snakes. When they're being fed live food, Mice or rat will actually start chewing on the snake if the snake doesn't eat them right away. So the way to prevent this is to leave the rat or mouse in the cage with the snake, monitor them, and if they're not eating it within 5 or 10 minutes, then you take the rodent out. Otherwise, this can happen. The good news is that these wounds will heal with some supportive care. Here's Jake. He's looking so much better. Such a nice snake.
He's nice.
Yeah. He's nice and warm, and you can see these wounds that he had are already starting to heal. It's going to take a couple of weeks, and we've got him down for 5 treatments right now of the antibiotic, but it may take more, so we'll just kind of play it out. These will probably not scar over, that's maybe not the best word, but it'll start to fill in. He'll probably do very well. So he looks so good though today, and he's nice and warm, and he's moving around a lot.
Yeah.
So
He looks good. He looks like he's a lot better than yesterday.
yeah.
Right.
And then, maybe give him a day or two before you start to feed him.
Okay.
Just kind of let him get acclimated back.
I'm gonna clean this tank out tonight.
You are?
for
Okay.
Today, and just
Okay.
new bedding and stuff. So.
Okay, if you have any questions, so you just come back here and we'll make sure that he's taken care of, all right?
Yeah, thank you.
Oh, you bet. It was my pleasure to work with him. He's a great snake.
Yeah.
Thanks so much. All right, you take care.
Elsa's about a 1.8-month-old female. Actually, the owner started noticing was not doing well, kind of sick, blah, not eating well, and then they started noticing like yellow skin. And they took her to their vet, and their vet saw that the kidney values were very high and the liver values were very high. So they did send out a leptospirosis, which is a parasite that dogs can get from licking the urine of either deer that come through your yard or even from mice that come through your yard. And all you need to do is drink like 1 to 2 drops of that urine, infected urine, and they can get the disease. It's pretty prevalent all over the United States, and the problem is there was a vaccine for a few of the species. That vaccine then completely wiped out that disease in the United States. We didn't see it very commonly, and then other species evolved after that. So then what the company did is they made vaccines for those new species, left out the old species in the vaccine, and now the old species are coming back. And the old species are the really bad ones. Though the newer ones cause kidney disease, the old ones cause liver and kidney. And I mean, she was basically, they were going to lose her for sure. It was down to where if we didn't get aggressive on that day that she arrived here, we would have lost her. So the treatment is doxycycline. And then the major thing is the fluid therapy to get the kidney values flushed out. And then we placed a nasogastric tube, which is the tube that goes down the nose and into the stomach. And this was her saving grace, right? And we started feeding through here a new special diet that's made by Lefevre. It's completely balanced nutrition for dogs and cats. And the big thing is it goes down the nasogastric tube and provides all the nutrition they need. And this dog has been surviving on this Lefevre's diet for about 6 days now. She still refuses to eat, but that's because her liver is so sick. And the kidneys are still a little bit high still, but they're going down almost to normal. And the liver's improving steadily, so we're gonna just continue. They're gonna learn how to feed through this nasogastric tube, which is pretty easy, but it's a family commitment because every 6 hours somebody's gonna have to be there to help feed this dog. So they're gonna learn how to syringe feed and
So here comes the fun stuff.
Here comes the fun stuff.
This will be your texture. It's thick enough, but thin enough to move down the NG tube. There's no clean way to do this, so I usually I make the whole bag and I will just pour it into the syringe. We have it wrapped up, and all you have to do is just pull this part out here and make sure that your tube is sticking straight up. You'll take off the brown cap and place the syringe right on there. And then you will just slowly push. Once it's capped on, it doesn't matter if you go this way, down, on the side, whatever. Make yourself comfortable, make her comfortable, because this is gonna take a while.
Okay.
So, and then you just slowly push.
There you go, Elsa.
Once she starts eating on her own, you can actually pull back on some of the syringe feedings. But we just don't want her to be constantly full on the syringe feedings. Because you need to flush that line after each syringe feeding. And then you're going to feel the difference when you know that that NG tube is clear of the Lefevre.
There we go.
Yeah, so as you push it, it kind of just pushes right in there, see? So that way you know that now it's clear.
Okay.
And you'll go right back up and call it a day.
Sounds good. Sounds
All right, guys, you have a good afternoon.
All right,
Thank you very much. It was a pleasure. You're welcome.
Banner's a year and a half. I got him when he was 3 months old, so we've been together for a good amount of time. We were out at the land, and we were inside, and it was time to go, so he usually just runs around by himself, so I called him back, and he was laying in the snow, wasn't moving, so went to pick him up, and he was whining, and then I got a little blood on my hands, and figured something bad happened, so took him, rushed him over here quick, blood in the car, he must have bled some more, and brought him in here quick, figured he got shot or something, so took him in here, and they patched him up. He's looking pretty good right now.
So these are the x-rays that we took on Banner the night that we presented to the hospital. And right over here you can see a lot of the buckshot, and the heart is not resting on the chest wall. And this space right here shows what's called pneumothorax. So we have air that got into the thoracic cavity. The doctor who was on that evening was able to take the air off of the chest. So this dog is very lucky to have survived. This is a very serious situation. All of this buckshot that we have remaining, it's questionable to go in and try to retrieve it because of, well, we don't know exactly how deep it is and what sort of trauma we'd cause by going in. So we are going to do a good, strong course of antibiotics and pain medications. Hey, Michael, I'm the doctor on today. You're Travis?
Travis,
So,
yes.
Hey. So, Banner's a very lucky dog. We did sew up the wounds here, and we had to put in some drains. There's one right here, and we have another one right here. You're gonna probably notice that there's a little bit of, it feels almost like air under the skin, kind of like the bubble wrap. And that's just gonna take some time to go away. It's probably because of the wounds that he sustained. With the pneumothorax, we know there was a puncture of the tissue, and the gas from the lungs went under the skin. So that's called subcutaneous emphysema. We had to stabilize him after the wounds, and we weren't able to do the repair until yesterday once he had been stabilized. So I know that Dr. Foster went over the x-rays with you, so...
that night.
So this is looking good. These are...
The little ones?
Yeah, those little ones are... He's got the buckshot's going to be under the skin.
Nothing serious?
Yeah, we're going to just put him on antibiotics, leave everything as is for now.
Okay.
Hopefully there will not be an issue with that. You know, I don't know about trying to go in and get all that.
Yeah.
If there might be more harm than good.
Okay.
So he's a very, very lucky dog.
This is 4 or 5-year-old little parakeet that presented here about a week ago for having an egg stuck in her uterus. And the egg was actually pooching out so we could actually see the egg, but it was too big to come out. So birds produce eggs, they're sterile eggs, they don't need a male there, but they just produce eggs, so you gotta think about it like a chicken. So chickens can produce eggs, they don't need a male for stimulation, they just produce eggs with yolk in it, and that's what we eat. Well, parakeets do the same thing, and but sometimes they produce such big eggs that it can't pass through. And last week they were able to get one egg out by cutting open the uterus, pulling out the egg, cutting open the uterus, removing the egg, and then sutured the uterus back. Well, then we took an x-ray and found that there's another egg up in the uterus. We left it in there, and we had the bird come back in a week later to see if maybe the bird would pass it herself, and she did not. So now we sedated her again, and we're going to put her under a general anesthesia and try to maneuver the egg out of the uterus. We're putting her down with a mask. You can see her little face in there. And then when she closes her eyes, she's already down. Okay, so now we found that we're going to have to open up the uterus. All creatures great and small, right? I put one more and then suture your knot, okay? Okay. I'll give an injection of antibiotics, which is, yep. Citavet that lasts a week. So now we have the egg, 2 parts of the egg, and that's what was inside. Kind of a misshapen egg where the yolk had been reabsorbed already. Now it's going to be our job to send this bird home and what we're trying to do is increase its night cycle so that the bird will stop doing this. We also gave a hormone injection, which is called Lucron, and that'll make the bird hormonally so that it'll stop the FSH production, which stimulates the brain, which tells it to produce an egg. So 2 parts to it. We gave a hormone shot to stop the production, and then secondly, we're going to increase the bedtime, so putting the bird to bed early so it has less of the light cycle. The light cycle is actually what makes the bird produce eggs. So if it has a longer nighttime, it'll be less likely to produce eggs, and then we're hoping we can stop this production. You are really, really, really cute. So the puppy was not doing well this morning. The owners just came home to find it really lethargic, not feeling well. We just took the temperature, and the temperature is 104, so that's pretty high for a little puppy. He's really dehydrated. He's got some kind of an infection going on, so we're going to get some more history from the owner and try to figure out what's going on with this little puppy. So, what's going on with the puppy?
Alrighty, so what we have is basically a 3-month-old male Yorkie mix who owners just got about 8 days ago from the pet store. They had noticed that everything has been going great up until this morning, where the puppy started acting a little bit more lethargic, didn't really want the breakfast, didn't really want to be walking around so much. They also noticed a little bit of sneezing and maybe a little bit of gagging as well. But when I also palpate his trachea, I get a cough every time, kind of palpating the trachea. And with the history of kind of coming from a puppy store with lots of other puppies around, and especially 8 days later, which the incubation period for kennel cough is about a week, I'm pretty concerned about that. So the owners gave me the go-ahead to get some radiographs and also some blood work from this little guy, and see if we can kind of come up with a diagnosis from that.
Puppies, being so young and not having a fully developed immune system, they'll get pneumonia, end up getting pneumonia because it'll go right into the lungs. So it's just like a child versus an adult. If you get a little cough, cold, you just go on your way, you take a little cough medicine and you move on. Whereas a little tiny baby gets a cough and a cold, it can turn into pneumonia just like this because their immune system isn't fully developed. Oh, this is the little puppy. This is the puppy laying on her side. So the spine is up here, front legs, and then this is the chest cavity with the heart being here. And then there's all little spot areas here, which is infiltrates in the lungs. Obviously, just as we determined, he does have pneumonia, and that's what's causing the fever. So we'll keep him back in isolation and then put him on IVs so we can get his temperature down, and then put him on IV antibiotics too.
We are gowning up so we do not touch the animal and then touch other animals. We will of course wash very thoroughly after, but just as extra precautions. We do not want the diseases in here getting out into treatment.
He just wants to like snuggle. Oh,
You're really cute.
Yeah, you're good, puppy.
We had to give some pretty hefty sedation just because they're a baby, and it's just like a little child. They don't understand, you know. Older pets, you can kind of console and talk to them. They've been through things at their vet before, and they've kind of been exposed to veterinary offices, shots, everything. This puppy came directly from a pet shop, so it's never had anything done to it, so it doesn't understand IV catheters and all these kinds of things. So he's getting that put in. And
Throw stuff at you.
Right?
Today's show was brought to you by Animal Fairy Charities, a premier organization focusing on animal welfare while teaching compassion to young children. For Pet's Sake Dog Training, Bichon and Little Buddies Rescue, and Camp Bow Wow, premier doggy day and overnight camps.